Okay, so that's Malaysia. We are now going by the branding of the world's healthcare marvel, and there's a lot of story behind this. But I was listening to all our session 1 speakers, and I'm getting more inspired about the light at the end of this dark COVID tunnel. So hopefully, when we recover from COVID, our healthcare travel industry is going to be more exciting and will rebound as soon as possible. So when we speak about post-COVID-19 medical travel or healthcare travel world, what would it be like? How do we adapt to the new normal? So that's what we will be sharing today, and feel free to have questions for us at the end of the session in the forum later. So just a quick background of Malaysia before COVID. So this was the ranking in a research done by IMTJ Research. So our colleague there, our friend Keith was there just now, and it was underlying views on medical travel and tourism global market. That was where Malaysia was in terms of the arrivals of international patients coming into Malaysia. So we were at the top, among the top medical tourism destinations. We were very happy with it. We were cruising as the top destination. We recently won as the destination of the year for medical tourism destination under the IMTJ Medical Travel Awards. So everything was looking great and fine for Malaysia, and if you look at how we have grown from the year 2015, 2019, we've been growing 16-17% year on year CAGR, and from revenue perspective, and we are growing from the volume as well. So everything was going the right direction for Malaysia. So, and for 2020, we had great plans. We were planning Malaysia Year of Healthcare Travel 2020 along the Visit Malaysia Year 2020. So 2020 was going to be great. A busy year, supposedly, for me and my colleagues at Malaysia Healthcare, supposedly traveling the world, positioning Malaysia as a top destination and everything. And believe it or not, to 2020, I myself have not set foot in an aeroplane, and that's how big the impact is. Normally I would be traveling the world promoting Malaysia. And 2020, not once have I set foot in an aeroplane. So that's how bad it is for Malaysia. And these are the challenges that not only Malaysia is facing, but everyone all over the world. And, technically we had complete reduction of travel because we have a very strict lockdown in March, April and May. And then, we basically all the work, everything that Malaysia had done great before will be reset to the base ground. It's the same for everyone. Everyone is suffering. And technically, when we look at our original target, we were supposed to record 2 billion ringgit revenue to the hospitals this year, with 10 billion ringgit impact to the total impact to the economy. And we are looking at about 70% reduction of our revenue on medical travel. And, thankfully, that's because we had a strong first quarter before the lockdown. So, and that's where we were. And then, and then we thought it's going to be a short, 3 months hit or 6 months on COVID. And we realistically, we don't know when our borders are going to be fully opened. So, yes, we had our successes in managing COVID. In the first phase, we had, Malaysia has been getting all these praises in the preparedness, ability to deal with COVID. We are among the highest testing in Asia, and our Director General of Health as recognized as one of the world's top doctors. We are up there in terms of alongside South Korea, and we were very happy to learn as well from South Korea, especially when it comes to technology, how South Korea has done it, and and Professor Kinam has been kind, to have exchanges with us as well along the way, and but so it all was fine for us, and then we have managed to, in a way, overcome COVID until, until recently. In October, we were hit with the third wave of COVID. So again, the public-private partnership that we had instilled during the first waves have been put in place again, so the public and private hospitals putting together our effort to combat the third wave. The third wave is currently still ongoing. As we speak now, Malaysia, most of the states in Malaysia are under a conditional lockdown. So technically, businesses go on, but we have strict SOPs that we have to follow. And most offices are working from home, like we are now. So, but, we are still riding the third wave of COVID. We are managing it. But before this, our recovery period was 97%. Now it has gone down to 70+% only. So because there are more new cases coming in and they haven't recovered. So we are dealing with the third wave of COVID. But what it hit us is that, we overcame COVID earlier, and then we sort of relaxed a little, and then we were hit with the third wave. So this is where we realized that, hang on, Malaysia, you need to adapt to the new normal, and we need to plan for our new future. So when you talk about new normal and new future, what do we do? How do we do this? So I think the new normal is going to be here for a very long time. I think it's beyond 12 months, perhaps, even though with the availability of vaccines and everything, we need to address the excess of that vaccines for all our people, not only for Malaysia, but for the world. Because even if Malaysia can afford vaccine for all our Malaysians and people living in Malaysia, but you can't open your borders unless people all over the world are also taking on the vaccine. So I think it's about the world adapting to the new normal. So for Malaysia, how do we do this? How do we plan for our new future? So that's what we have been debating. And I think, even not only for medical travel, but also for all our businesses, how do we balance, protecting the country from COVID infections and handling the crisis versus opening up our economy? So that's always been the thing that we are planning, So what do you do? So what we are doing now, the country is addressing these issues. What Malaysia Healthcare Travel Council is looking at for our medical travel as the key export service for the country, we are now going out, repositioning Malaysia Healthcare in a big way. We may not be as lucky as Korea to get all the big coverage all over the world in terms of how Korea has successfully handled COVID. We need to do more because not everyone have heard about how well Malaysia has dealt with COVID. So what we are doing now is we are going out and repositioning and rebranding Malaysia as a world's healthcare marvel, showcasing all of our healthcare best practices. We talked about the continuity of care through telehealth and using of the technology, and we are developing Malaysia as a thought leaders in terms of content when it comes to not only healthcare travel, but from the healthcare overall. So we are now currently in the process of, we have deployed our aggressive PR and branding campaigns. During COVID time, we are supporting and enabling, facilitating all our healthcare facilities, public and private sector especially, and also amplifying our expertise, having webinars. We do a lot of health talks, etc., all on the social media, so that we will continue to engage. We continue to engage our 1.3 million patients that came into Malaysia last year. We do not want to lose them, so we continue with the engagement with them through the World's Healthcare Marvel campaign that we are currently running at the moment. But doing that, we are adapting to the new normal. So we must make sure that how do we handle all these things? How do we we build stronger foundations in terms of pushing to the better and quicker recovery. We stand on the trust that we had before, and we build stronger trust. We want people to remember Malaysia as the place where you can have quality care for their peace of mind. So they have that brand that Malaysia is a world's healthcare marvel, and we can trust Malaysia, and you have the peace of mind when you come for Malaysia. You'll be safe, you'll be getting the best global treatment. So that's what we are doing currently. So we are building capacity along the end-to-end value chain. We're training industry players. We're building new partnerships for marketing and patient referrals, even though they cannot freely come into Malaysia. We explore new technology to support this new normal and, create new behaviors and, for our existing and potentially new patients that we can, that would be able to come to Malaysia during that period. But, we acknowledge the borders are not going to be open for very soon. So that's why on the 19th of June, we have created a medical travel bubble. And that's the first sector that was opened to welcome patients coming into Malaysia on the 1st of July. But we have very strict protocols, very strict SOP in filtering our patients to, when they want to come into Malaysia. So, and then we had phases to allow them to come in. And that's where we are focusing on at the moment. So then the 5th October, we have allowed patients to come on commercial flights as well from less risky countries. So that's what Malaysia Healthcare Travel Council has worked towards. So what is that new future for Malaysia Healthcare, for our healthcare travel journey? So, it comes to a stage now that if you want, you need to apply to come to receive treatment at our member hospitals, and then we have, we will give permission, we will work with the immigration department. They have to test for COVID before they come in, PCR test 3 days prior, and then they can travel by chartered commercial flights or ambulance according to their, where the country they're coming from. Upon arrival, Malaysia Healthcare Travel Council and hospitals will welcome them directly and take them directly to the hospitals. They have the 14-day quarantine while they undergo treatment, and then only after day 13, if they test negative, can they leave, or they leave the hospitals for follow-ups, etc. So these are the current travel journey. And since the 1st of July, we have welcomed many patients already coming back into the country, and that has helped with our revenue in rebounding from COVID pandemic. So currently we are under phase 2. We have phase 2B and we have phase 2C. As and when COVID improves and as and when our borders get relaxed, we will move into the different phases. So currently we are in the phase 2, where we allow some countries, patients for some countries to enter by commercial flights, but the others we are still strict with chartered flights or air ambulance. So that's some pictures of the arrivals. You can see that our hospitals are in PPEs, welcoming patients, etc. But we do this in the interest of the patients themselves. Patients need to feel safe when they arrive in Malaysia, and they need to know that they are getting the best care for their treatment, and they are safe from any kind of risk. It's also to protect Malaysia and Malaysians as well. So all the different cases, they have arrived in Malaysia since the 1st of July, and we are still welcoming quite a few of them as well as we speak. And we are hoping that, by 2021, we are seeing a healthy rebound moving to 2023. That's our chart. If you don't do anything, the rate 1 would be, where we are. So we are trying to work towards the blue curve so that we can actually rebound faster from the pandemic. So we will run our Malaysia, the World's Healthcare Marvel campaign actively from now on. And then we will relaunch our Malaysia Year of Healthcare Travel as and when times get more suitable and better. So, and talking about the support and the trust from our Malaysian government, they have continuously supported our effort in terms of promoting healthcare travel as the key export service for Malaysia, one of the key export services. And this was announced last Friday in the budget 2021 for the country. And that's the Minister of Finance presented the budget, and we are given an extra 35 million ringgit for this for 2021 to beef up the campaign and the activities to ensure a stronger rebound for Malaysia Healthcare Travel Council. So, and that's our Director General of Health. He says that I strongly view that addressing COVID is an all of government, all of society responsibility. And that's what Malaysia is doing at the moment. And even though we are tested with the third wave of COVID, we are positive that we will rebound, we will get out of that very soon, and our economy will rebound healthily in 2021. And I would like to thank everyone for your attention. And thank you very much to Professor Kinam for this invitation, and also to the team. And I look forward to your question. Kamsahamnida.